Greetings to all. My name is Dr. Parvathy, PG Scholar, National Institute of Siddha. First of all, I would like to thank the organizers of Knowledge Festival for giving me an opportunity to present my topic. So the title of my topic is Scoping Antiviral and Immunomodulatory Activity of Siddha Polyherbal Formulation, Arathai, Kudineer, Churnam in the wake of COVID-19 pandemic situation. Next slide, sir. First of all, I would like to say a few words about the Siddha system of medicine. Siddha is one of the ancient systems of medicine which incorporate the extensive use of herbs, inorganic and animal products for maintaining a healthy life. Siddha system has diverse and extensive use of natural resources for the prevention and management of comorbid conditions, widespread epidemic or pandemic diseases. So as we know, healthcare system in India is still struggling with the second wave of COVID-19. So we are frequently hearing about immunity, immunomodulation, and the prophylactic measures, etc. So the role of immunology to deal with this pandemic has been a stimulating concept, and widespread efforts have been made to identify agents as prophylactic agents or therapeutic regimens to combat COVID infection or to reinforce the immunocompetence of the host. Even in this COVID pandemic situation, the role of immunomodulator is well established as a key component. Siddha system has a lot to offer in the management of immunocompromised disorders in which it has the lowest possible side effects. And certain herbal drugs are believed to promote positive health and maintain natural resistance against infection by re-establishing the body equilibrium and conditioning the body tissues. So the use of herbs for improving the natural resistance of the body against common infection is the guiding principle of Siddha. Next slide, sir. So as we know, conventional immunomodulatory chemotherapy costs a huge expense and it is unaffordable, and it has some side effects also, like it induces pulmonary toxicity or nephrotoxicity, neurotoxicity, or it may increases the chance of infection also. So a number of synthetic drugs are being used in immunotherapeutics, and the diverse adverse side effects caused by them has produced awareness to limit the usage and to search for a safe alternative. So there is a need of a safe, cost-effective alternative for this. The Siddha system has tested thoroughly the herbs and the polyherbal formulations via in vitro and in vivo methods, which include Urei Madre, Kshay Churnam, and Nilavimbu Kudineer, etc. A wide number of herbal formulations or preparation have been indicated in Siddha literature towards the management of several diseases that result in immunodeficiency. But many Siddha drugs have not been characterized completely using modern scientific methods, and the key bioactive constituents are yet to be explored to a greater extent. So what I mean is more pharmacokinetics and pharmacodynamic studies have to be carried out in the Siddha system of medicine in the field of Siddha. So the effectiveness of number of Siddha formulations or drug are being scientifically validated and proved, thereby supporting and promoting the value of Siddha system of medicine. For example, Brahma and the Bhairava Matre and Nilavimbu Kudineer, which are extensively used in the Siddha system of medicine. It is effective against chikungunya infection, and evidence-based medicines like Nilavimbu Kudineer and Arathai Kudineer and Amakuri Churnam, even Kabasura Kudineer also, they are extensively used in the dengue outbreak, and even in the COVID pandemic situation also, it is a very good remedy against, actually it acts as a prophylactic measure against dengue infections. And also Kabasura Kudineer, Sarvasura Kudineer, Vishasura Kudineer, these are all decoctions actually. These are effective against swine flu fever. Next slide, sir. So what is immunity? Immunity is nothing but it is a body's natural defense system against various kinds of infections. So actually the immune system is a host defense system comprising many biological structures and processes within an organism that protects against diseases. So to function properly, an immune system must detect a wide variety of agents known as pathogens, viruses, parasitic worms, and distinguish them from organisms' own health tissue. So that's the thing. And immunomodulation, immunomodulators. This is nothing but the biomolecules of synthetic or biological origin capable of modulating, suppressing, stimulating any component of adaptive or innate immunity. These have the ability to alter the immune response in humans and animals against infectious agents. So immunomodulators are widely classified into immunosuppressants, immunostimulants, and immunoadjuvants. So immunostimulants are the agents that activate or induce the component of immune system, and immunoadjuvants are specific immune stimulators which enhance the efficacy of the vaccine, and the immunosuppression that are the molecules that inhibit the immune system that can be used to control the pathological immune reaction. That means it can be used in the autoimmune diseases like rheumatoid arthritis or something. It can be used in the organ transplantation, something like that. So as I told before, we need a safe and cost-effective alternative. So herbal modulators is something like that, and it can be used in which it stimulates or suppresses the component of immune system, including both the innate and adaptive immune responses. It is a good substitute for the synthetic chemical compounds, and there are some plant-based phytoconstituents like flavonoids, lactones, alkaloids, ditapenoids, glycosides, which exhibit extensive, significant immunomodulatory, antiviral, anti-inflammatory, and antioxidant activity in various scientific articles, studies. And in one more addition to 108 medicinal herbs called Karpamoolikal are predominantly used in Siddha system of medicine for treating certain diseases and as an antioxidant and immunomodulator, which were used extensively in case of dengue and HIV epidemics. The plants are also rejuvenators to boost the health and thereby prevent chronic diseases and reduce aging. Next slide, sir. So what is the mechanism of immunostimulation? So the primary target is the T or B lymphocyte stimulation. So there is an increase in the phagocytosis by macrophages. Macrophages are the first line of defense in the host cell mechanism, and the granulocyte also. This plays a central role in the immunostimulation and a stimulation of T lymphocyte, which can be achieved either directly or indirectly via macrophages. And cytokine modulation caused by herbals. These are herbal medicines on cytokines have shown greater potential and as an anti-inflammatory action due to the inhibitory effect on interleukins 1, 6, tumor necrosis factor, and TNF, and interleukin 8, and the boosting effect of interleukin 10, which has an agonistic effect to the pro-inflammatory cytokines. Next slide, sir. So what is the concept of immunomodulation in Siddha? As per the Siddha system of medicine, food is medicine and medicine is food. Unave marundu and marunde unavu. That indicates that proper diet and healthy lifestyle containing medicinal herbs are intrinsic elements that allows the body to remain healthy. The great saint, the great Tamil saint Thiruvalluvar has insisted the significance of diet as the cause of disease in his chapter called Marunda, medicine. So as per the Siddha system of medicine, food is medicine and medicine is food. And immunity is termed as one in Siddha, and it has a direct association with the Uyir Tadukal, that is Vali, Adal, Ayam, that is Vada, Pitta, Kapam, 3 humors and 7 Udal Tadukal, body tissues like Saram, Chenir, Un, Pulpa, Inba, Mulai, Suklamo, Stronadam, that nourishes the body. So the human beings are a subtotal of Uyir Tadukal and Udal Tadukal, forming his or her strong physical and mind in resulting in a strong immune system. So as we know, immunity is divided into 3 types: innate immunity, acquired immunity, and passive immunity. As per Siddha concept, natural immunity of the human body by birth is called Iyarkai, and its improvement with the help of intake of balanced food and medicines is called செயற்கை வன்மை, and then the physical change under the effect of seasons and is called a Kala Vanmai. So these are the 3 main types as per Siddha system of medicine. So if a individual is called healthy, individual called is healthy if he possesses the equilibrium state of doshas, that is 3 body humors, and Agni, that is biodigestive fire, and Dhadus, tissues and physical constants, and the malas, waste product of the body. So the body is firmly, as I told before, the body is firmly supported by the Vada, Pitta, Kapha. So the abnormal and vitiated Vadam causes the derangement of the immune system that produces diseases. So, like abnormal and vitiated pitta greatly disturb the digestion and metabolism, leading to the development of diseases. And abnormal and vitiated vitation of carbon greatly alter the immune system, resulting in diseases. Likewise, a diminished state of doshas is not capable of vitiating other dhalus. So, the total number of 7 physical constants, as mentioned in the Siddha literature, which are also support and nourishes the body. So whenever the expression or function of one of the dhatu is impaired, the immune disturbance occurs and disease developed. So that's the principle. Actually, then the proper elimination of malas indicates the good health, and any abnormality is caused the disease development. Likewise, actually, it is not visible here. According to Siddha system, Vadama Padaita, Pitta Vanyai Kada, Sletumama, Sidamai Tudaita. That means Vada is for creation, Pitta is for prevention, and Kaba is for destruction. So Pitta is mainly for prevention. That means it is responsible for the immune function. So whenever the derangement of Kaba occurs, it can be rectified by the increasing oral humor, that is pitta humor. Automatically the immunity will be developed. So that is the principle in Siddha. Next, sir. So coming to Arathai, Kudineer, Churnam. Arathai, Kudineer, Churnam is a classical Siddha polyherbal formulation. It contains 5 plants, namely Citrarathai, Alpinia officinarum, Perarathai, Alpinia galanga, and Adimaduram, Glycericia glabra, and Tipili, Pipalongum, and Talisabatri, Abies webiana. So it is mainly indicated in Siddha literature for immunocompromised disorders such as fever, respiratory infections, dropsy, eczema, and arthritis. It is mentioned in the classic Siddha literature, Siddha Proprietary of India, 2014 edition. Next slide, sir. So these are the phytoconstants and the mechanism of action of these herbs. So in general, Alpinia galanga, which has a high amount of flavonoids like quercetin, camphorol, isoramnitin, camphorite, galangin. So actually, diterpenoids in galangal were proved to have a broad spectrum antiviral activity and immunomodulatory activity and inhibitory activity on pro-inflammatory mediates, and it is scientifically reported to inhibit the replication of HIV. So there are evidence for the Alpinia galanga also, and Glycericia glabra, which is rich in flavonoid content like liquidin, isoliquidin, liquidigenin, and ramno, liquidin, and etc. So in acetyl muramyl peptide is a glycerisin analog with the potential immunostimulating properties, and glyceric acid have to be shown the inhibit the growth and cytopathology of numerous RNA and DNA viruses. And another interesting thing is licorice constant also exhibits a steroid-like anti-inflammatory property, which is similar to the action of hydrocortisone. There are lots of studies have been conducted in the COVID situation regarding Adimaduram, that is Glycericia glabra. Even Chinese traditional medicine also, there are lots of papers. And next is the Pipalongum. Pipalongum, its phytoconstants are piperine, methylpiperine, piperanoline, piperacin, acerine, etc. So the main mechanism of action is it increases the total WBC content, bone marrow cellularity, and the total antibody production. So it is found to activate the macrophages. So that is the first line of defense from a host infection, and phagocytic index, and it indicates the immunostimulating activity. Next is the Alpinia officinarum. Like I said, for Alpinia galanga, it also contains diterpenoids, steroid flavonoids. It actually helps to regulate the COX and non-COX signaling pathways. Actually, it's a cyclooxygenase enzyme. It is responsible for the formation of prostaglandins. So it inhibits the formation of prostaglandins. So it actually COX pathways, it actually catalyzes the conversion of arachidonic acid to prostaglandin. So this Alpinia officinarum, phytoconstant in Alpinia officinarum, like galangin, helps to regulate the COX pathway. And Abies webiana also have potent inhibitors of prostaglandin synthetase. Next slide, sir. So these are the scientific evidences regarding the herbs of the drugs of the Alpinia galanga. There are various studies have been conducted to prove its immunology and antiviral actions. Next slide, sir. So these are the papers. Next slide, sir. Next slide, sir. So the antiviral activity of Arathai Kudineer Churnam with special mention to COVID-19. So the phenyl, I will mention some of the polyphenol propanate in galangal shows potential inhibitor to SARS-CoV-2 against the target proteins RBS S and PDAC2 and SARS-CoV-2 protease in molecular docking studies. And glycyrrhizin, which I have mentioned before, exhibit antiviral activity against SARS-CoV-2 and some other viral infections also. Likewise, Taxol and Baccatin-3 exhibit strong interaction with the targets of SARS-CoV-2 and human ACE2 in molecular docking, and Taxol has the inhibitory activity on human immunodeficiency virus, HIV virus, and the human breast cancer, and inhibitory action on the SSV virus and the verocells. Next slide, sir. So, with the constant increase in the number of cases and the potential possibility of health system across the state in countries getting overwhelmed. So, what is the logical approach? So, what is the logical approach is to protect the unaffected population should be aimed at boosting the immunity. So, this is where the potential of traditional disciples like Siddha need to be harnessed. Many of the bioactive principles present in the herbs are proven to be Arathai Kudineer Churnam are proven to be the effective immunomodulators, antiviral, antioxidant, and anti-inflammatory agents based on the pharmacokinetic of their bioactive compounds. And active principles like the glycyrrhizin, phenylpropanoid, hyperonic acid, and Baccatin-3 showed remarkable inhibitory activity against SARS-CoV-2 in molecular docking studies as well. So in general, Arathai Kudineer Churnam is a polyherbal decoction with the 5 components, and each of them are in themselves strongly established herbal plants, and those synergistic activity might probably improve human immune response and lead the human body to healthiness. Next slide, sir. So coming to the Siddha part. So the therapeutic efficacy of the drug is mainly based on the phytoconstants of the phytoconstants present in the ingredient. So according to Siddha, the efficacy of drug is assigned upon the ingredients of taste fundamental theory and 5 elemental theory and its potency, that is virium, and its actions, unique characters, mahime. So the drug used in Siddha system were identified by 5 properties like suvai, that is taste, virium, potency, gunam, character, river, class, and the mahime, action. All these 5 properties are based on the 5 elements, that is Panchabhutams, that are present in the drug. So Siddha system equates COVID-19 to Kabasura. Slathma fever, it's a synonym. Actually, the symptoms of Kabasuram or Slathma fever, cough, throat pain, anosmia, and ageusia, shortness of breath, and fatigue. So in Siddha field, COVID-19 can be is correlated with the Kabasuram, and in severe stages, it can be lead to Kabavadasuram and Sannibadasuram, which are the delirious stage. Next slide, sir. So the Siddha concept about constituents of Arathai Kudineer Churnam. So in this table describes the name of the drug and its common name and the parts used and the actually taste of the drug and the 5 element perspective and the humoral theory and its action. So Alpinia galanga, it is commonly known as greater galangal, and the rhizome are the most useful part. It has carp taste, that is acrid taste. So acrid taste is responsible to pacify the vitiated cover. So as I told before, Siddha system correlates, equates the symptoms of COVID-19 with the Kabasuram. So it automatically pacifies the vitiated cover. Likewise, the Glycasia glabra also pacifies the vitiated Vadam and pitta humus because it has sweet taste and it has a combination of earth and water. That is a Panjabhudam. And its actions are tonic, emollient, and a mild expectorant. And next is the Piper longum. It has also carp taste, that is function taste, active taste. It pacifies the vitiated carbon. And the Alpinia galanga, likewise, this also pacifies the vitiated carbon, and Abies babiana pacifies the vitiated carbon. So most of the drugs are pacify the vitiated carbon. So it can be recommended for the management or as prophylactic measure for COVID-19 as per the Siddha concept. Even I have shown the evidence of modern evidence from modern articles also. Next slide, sir. So my point is, Siddha is a bundle of desired information that has to be explored and implemented for the healthy well-being of the human being. So based on the available information from Siddha literature, proven scientific article, the trial drug Arathai, Kudineer, Churnam can be given for enhancing the immune system of the body and for prevention of COVID-19 infection. And the various phytochemicals present in the Arathai, Kudineer, Churnam will help in suppressing and curing the clinical symptoms associated with the COVID-19 infection. And more detailed studies has to be carried out for obtaining a scientific approach to this formulation and develop it as a viable therapeutic alternative against COVID-19 infection. Next slide, sir. So these are the references. Next slide, sir. Finally, thank you, sir. Thank you for the patience. I would like to express my sincere gratitude to my guide, Dr. Shivakumar sir, and my director, Dr. Meena Kumari ma'am, for the constant support and encouragement for participating in this knowledge festival. Thank you, sir. Thank you.